Thank you, Mr. Chairman, and thanks for having this hearing. Secretary Gibson, as I understand it from the briefings to staff, the VA previously wasn't tracking metrics for off-VA care. Can you explain why this was not being done and perhaps what is being done now, if anything?
Got it. I think what we were saying before is that because we have such a patchwork of different programs for delivering community care, the CHOICE program, the PC3 contract, our affiliations with DoD and academics, they all are in a silo, and VA doesn't have the visibility that it needs to really assess kind of supply and demand. Do we have the right population of doctors, the right specialties in the right areas? Can we actually assess and monitor quality at the regional and national level? We don't have that level of visibility today. So in the kind of the one-time cost system improvements that we articulate, those are the capabilities that we need. We need to have that visibility at the national level to be able to assess how do we better match supply and demand and how to monitor quality of care for our veterans. So you're spot on. That's what we're asking for.
I think the other light to shed there, VHA has historically operated as a loose confederation of medical centers. And what we're talking about here is moving toward an integrated enterprise. And so oftentimes what I find is out at a medical center level, there actually is a pretty good finger on the pulse of the care that's being delivered by local providers, because providers inside VA know who they're referring patients to. They know about that provider, and they are seeing their patients and assessing that provider experience. But that is not consistent all across the entire administration. We need to operate more like an integrated enterprise so that we've got that kind of consistency.
Okay, thank you for that answer. And I'm going to shift gears and ask about IT. We had a hearing recently, a combined hearing with another OGR committee, about how the VA and DoD is not able to share medical records. But some of what the plan is you're talking about for the future is hinged on a cloud IT system for better sharing between the VA and community providers. So if the DoD and VA haven't been able to really integrate after 17 years, why do you feel it's going to work to do something differently with the community providers in the VA?
First of all, as it relates to interoperability with DoD, this came up at our breakfast the other day, and I would plead with any member of this committee, give us an opportunity to come over and demonstrate for you today what's happening, the information exchange that's happening between VA and DoD. We routinely offer those briefings. We get staff coming, but we never can seem to get a member to come. And so please, we would love to have to come. I'll come too, and we'll put on that demonstration so that you can see we're exchanging electronically vast amounts of information with DoD every single day. Okay, so we'd love to share that with you.
If the gentleman will yield, members,
yes.
We will take the VA up on that. It may be an early morning breakfast event. I'll bring the chicken biscuits, and we'd love to see it.
Mr. Chairman, thanks for your initiative on that. I appreciate it. And
the other part of the issue has to do with the Health Information Exchange, the portal that Dr. Shulkin was talking about earlier. Other comments to add there, either?
Dr. Shulkin, can you add anything to that? The cloud IT system,
yeah.
The community provider sector?
When you come to this demonstration, because I had a chance to see this in North Chicago, one of our integrated facilities with the Navy, as our doctors were going back and forth between DoD and VA systems. So this joint viewer does allow that. A health information exchange exactly provides that opportunity with community providers. So you do use the cloud, and you're able to go back and forth. It's not one integrated medical record. I mean, we'd all love to see that, but the commercial companies are guarding their software protection to do that. So what you have is the ability to see information, clinical information, and I think that's what you get with the health information exchange as well.
Okay, thank you. Mr. Chairman, I yield back.
Thank you. Ms. Brownlee?
Thank you, Mr.